Hello and a warm welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwarz, licensed midwife and one of the MCs here at Gold. And I'm here and I'm so excited to be here with Kathryn Stagg. Hi, Kathryn. Welcome back.
Hello, nice to be here.
It's wonderful to have you back here at Gold, back by popular demand. This time you will be presenting as part of an add-on lecture pack. And the title of the lecture pack is Breastfeeding Solutions for Preterm and Late Preterm Infants. And your presentation is strategies for managing nighttime breastfeeding with multiples. And you're quite the expert in the field. So tell us a little bit about your background here,
An
Kathryn.
expert in that I've lived it, yes.
Yeah.
So yeah, I am a mum of twins, first of all, which is why I'm super qualified for this. So yeah, my twins are now 19, so thankfully they sleep very late into the morning nowadays. But yes, so I mum of twins, also two others as well. Though actually it was my singletons that caused more issues with sleep than my twins did. But yeah, they're all quite different at the end of the day. But yeah, I trained as a breastfeeding peer supporter when my twins were about one. And volunteered a lot in the local area, and then just absolutely loved it. So basically did my breastfeeding counselor training and then took my lactation consultant exam eventually after a lot of faffing trying to work out how to do my health sciences. So, yeah, so I took that and passed, thankfully. So I became qualified in 2018. So I've been a lactation consultant from then. I also, about a year later, I got given the opportunity to be one of the first cohorts through Lindsay Hookway's holistic sleep coaching training. She was just developing the course and she was sort of trying to get people to try it, basically. So she I was one of the first, I think I was the second group that did that. Fantastic. And it's so intertwined with breastfeeding. Half the questions that we get asked are often related to sleep, aren't they? That they've got a sleep
Right,
element to it as
absolutely.
well. And I thought it was so important to actually get some proper evidence-based training around this, because there is so much rubbish that you can
Exactly.
read
Yes.
on the
Yeah.
internet. So Lindsay is queen of references. She just has done a mega deep dive into all the research around everything. So I trusted her that her course would be very evidence-based and also gentle, because she's very much, she likes to very much sort of promote attachment and
Hmm.
not just leaving babies to cry and such, like, which was something that I wasn't really comfortable with
Right.
doing as well. So
Yeah.
that's the reason why I ended up doing that as well. And it's so I kind of now support with both. It often intertwines. I get a lot of clients who go, which session shall I book? And I'm like, I charge the same for both. So I'm like, whichever. I mean,
Right,
we'll
right.
talk about all of it anyway, so it doesn't really matter. So,
Absolutely. It's
so
so intertwined. Yes.
it is absolutely.
And you mentioned evidence-based care. That's one of the important things, right? As you
Yep.
mentioned, there's so much stuff on the internet, books, I mean, podcast, you name it, like on social
Yep.
media. It is really, really important to really go for what does the evidence really say, and that's,
Hmm.
I know, and you're very diligent in that and really only really bringing that to the forefront, because there
Yep.
is, as you said, it can be very dangerous, especially when we talk about sleep coaching and stuff. There's a lot of stuff out there that is not really beneficial for the family or for the baby,
Yeah,
so yeah,
absolutely.
so wonderful for that you are, conquering that world there as well. And then
Kind of.
multiples, that brings us throws in a whole other aspect of it,
Mm,
right? We know already nighttime feeding is quite challenging,
yep.
especially you're recovering from birth and the hormones are going haywire, and then at the nighttime not getting any sleep. So that is a
Yep.
big issue right there.
Yep.
But then throwing in multiples, and that's a whole other story,
Hmm.
correct? So
Yep.
in your practice and what you've experienced yourself, what are basically the biggest challenges, would you say, when it comes to
It is
nighttime
literally
feeding?
just getting any sleep at all, actually, especially in the early days, because a lot of babies will sleep more. Yeah, they will feed more at nighttime than the daytime to begin with. They're often quite unsettled. They do a lot of cluster
Mm,
feeding. They take a lot of work to actually settle them to sleep, and they have no circadian rhythm when they're first born, so they're completely all over the place. They do often actually sleep a bit better in the mornings, quite frequently. So it's sort of trying to be able to get the parents to, you know, establish breastfeeding, working on that, but also, you know, you can sometimes literally be feeding a baby especially if they're not tandem feeding, if they're single feeding, you know, it can take, I can remember my, when I first went to a breastfeeding support group and my babies were about 6 weeks, and I got to the stage where I could settle both of them in about 45 minutes, which was a bit of a win for me because I had up to then been doing a lot of where I was barely sleeping. So,
Right,
and
absolutely.
the health visitor who was facilitating that group was like, "Oh, that's sounding, you know, doable now," you know, because she'd been supporting me a bit in the run up to me actually managing to get out of the house. So,
Yeah,
so, you know, so, but it just takes a long time to kind of get them, you know, down for sleeps, and you know what I mean. So it's just
yeah.
that window of sleep that you get with a singleton
It's
is much shorter when you have twins.
Yes, yes, absolutely. And the thing is, like you know, I remember speaking to a client a long time ago, and she was saying, "Oh, the books always say put them on together, but then one is sleeping and the other isn't." You know,
Mm,
and then you
yep.
don't want to wake the other one up, and then it's like becomes this kind of overwhelming
Mm.
situation because you know sometimes it's you know theory is so easy. Oh, just put them on together and well, you can do it. And then, but reality is quite different, right? Right, Kathryn?
Absolutely. We get a lot of questions on our Facebook group, like, I love tandem feeding, but how do I get out of it? So, because you sit there, their baby, you know, sometimes they're on a cushion
Yeah,
and, you know, they've both fallen asleep. You're like, if I move, they're going to wake up.
exactly.
What am I
Right,
going to do?
right,
I don't know how to
right.
do this.
And again, this is also about safe sleep, right? Like you know, we
Yep.
always talked about like if you you know somehow have your baby with you, don't have any bedding, don't have any pillows, but then babies are asleep, you don't want to move, you know, you're worried. I mean, you're overtired yourself,
Yep.
worried that you're falling asleep, and you're constant. And then in your head, the alarm bells go off. Oh my goodness, what about all the pillows? What if I fall asleep? What if something bad happens? Right? Can you
Yep.
speak about that a little bit too?
Yeah, so I mean, the best thing to do is to kind of follow the safe sleep guidelines as best you can. There's nothing specific out there for multiples at all, so we just kind of
Hmm.
try and follow the guidelines for singletons as best we possibly can. You know, so if we are, you know, trying to safely bed share, we're putting them on, you know, we're using the cuddle curl, you know, where the mum is lying on the side and pillow up here out the way, duvet tucked around you or covers tucked around you, so they're not, you know, babies in their own covers, maybe a sleeping bag or in their own blanket, that kind of thing, so they're not overheating. Making sure that they can't roll and get wedged anywhere, make sure that
Right.
they're not going to fall off the bed, to make sure, you know, so all the kind of standard stuff, and making sure that we're not compromised, you know, we're not taking any medications that might make us sleepy, we're not drinking alcohol, we're not, you know, all that kind of stuff. So just trying to make the environment as safe as you possibly can, and then that's the least risky way of doing it,
Right.
you know. And then there are some times where you just, even putting them down next to you, they wake up straight away, isn't it? And the only way you seem to be able to get them to settle is on your chest, and you're just like, oh my god, everyone tells you not to do it, but you're falling asleep. So again, just looking either side. If you do fall asleep by accident, it's better to be in a well set up bed that, you know, there isn't any risk of them getting wedged somewhere, there isn't that kind of
Right.
stuff. Hopefully you'll have someone you could pass them to in that situation, and they
Right.
could do a bit of cuddling and you could sleep for a bit and tag team with your partner and that kind of stuff. But sometimes there isn't anybody and you're falling asleep. You know,
Hmm.
getting up and sitting on the sofa or the armchair is by far much riskier
Much
than
riskier.
in
Hmm.
a well set up bed. So, you know, it's
Yeah.
just whatever we're doing, we always talk about just, you know, reducing those risks as best we possibly can in the scenario that we find ourselves in, really. I think that's the only way we can discuss it with people. And then it's up to the parents to make informed decisions themselves about how they decide to manage, you know.
Hmm. 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 Absolutely. Now, here comes a little bit of a weird question, and I don't know, it popped into my head, and maybe there isn't an answer, or you know the answer and it's easy. Are there any differences in sleep and feeding management between identical or fraternal twins? Does that even matter? I don't know. It's one of those things that I think like maybe identicals
Yeah.
are more like similar or not similar. Who knows, you know? Is there anything you can tell me about that?
It's an interesting one. I don't think there is any research. I certainly haven't seen any in my little bit of a deep dive that I did for this presentation. I haven't found anything. But from
Mhm.
my own experience of supporting families, the only thing I would say is that because identical twins are genetically the same as each other, although their
Right.
personalities can actually be quite different. epigenetics, all the kind of, it's fascinating, honestly, so fascinating having identical twins. But they do seem to have a baseline of having similar kind of sleep needs to each other, you know, because I think that is there does seem to be a genetic factor to that. You know, so you know, they did come from one embryo that splits into two babies. So, you know, that basis, although there's environmental factors in the womb and then environmental factors after birth that's going to influence their development, that basis is that they are basically the same. So I do think that a lot of identical twins seem to have similar sleep needs to each other. Whereas if you have fraternal twins, they come from two separate eggs and sperm. So they're really no more similar than any standard sibling, you know. And so anyone who's had more than one child knows that, you know, you get your first baby, you get your second baby, and they've slept completely differently to your first baby, and then you have another one. Usually the third pregnancy seems to be the one that's awful, from what I've it seems to be that case. So yeah, and it seems much more challenging for some reason, who knows why. But you know, they're quite different from each other. And so if you have a fraternal set of twins, it can be more challenging from that point of view, because they do have different needs. I believe.
Yeah.
So, but I'd love to see some research on this. It would be fascinating.
That would be fascinating. That would be fascinating. Yeah. Right. So if parents feel overwhelmed by nighttime feeding with multiples, what professional resources or subsystems can you recommend? Maybe, of course, like somebody like you and IBCLC, of course.
Yep.
But what else is out there? What else can you recommend that would be beneficial, especially when you're working with multiples?
I mean, just having a basic knowledge of realistic expectations about how babies should sleep, first of all. I think, you know, there is so much rubbish out there that says that they should sleep through the night at 3 months, or they should sleep through the night when they reach this size or weight, or all this sort of stuff. So just having that realistic expectations that actually, what can we actually expect our babies to do? Twins are just babies at the end of the day. They just happen to be, you know, born at the same time, but they are going to behave like a normal baby. When they are born early, sometimes they will be more like their adjusted age rather than their, you know, we have the expectations for their adjusted age rather than their actual age, especially if they're born quite early. It can make quite a big difference. But you know, so that's the first thing. Finding actually evidence-based sleep is very, very difficult. So anyone who's done Lindsay's training is somebody that I would trust, first of all, because the training was incredibly evidence-based and you know, that kind of stuff. So that's always a good sign. Her books are very good. She's got, I mean, they're aimed at singletons, but she's got 2 for parents, which are you know, what's the first one called? Let's Talk About Your New Family Sleep is the younger babies version, which is great. So it's got a little bit more easy to read for parents, not quite so research, you know, there's not so many references in it as her holistic sleep coaching book. So I think that's a place to start with reading. I always say to people, if they're following people on Instagram or on social media, that if it's something that doesn't sit right with them and makes them feel bad, it's probably best to unfollow it, because it's probably that it's not.
That's a good advice. Yes.
not feeling, you know, if it's making them feel like they're failing as a parent, that probably means that, you know, it's something that they don't need to follow. So,
yeah, absolutely.
and then just trying to simplify your life as much as possible. That's really the main thing, is just trying to let go of those things that you don't have to do. Let go of those, trying to prioritize the parents' sleep as much as possible. You know, whenever there is an opportunity for them to be asleep, try and make sure they're asleep. Basically.
Prioritize, yes. Prioritize sleep. It is so important, because, you know, this is such a, you know, in the big picture, a very short time, right? And it feels for the parent, of course, forever in that moment, you know, but like let go of any unrealistic expectations to, you know, the house doesn't have to be clean. It's okay, you know, nobody will look back into that time of life thinking, oh, I should have cleaned my house more, right?
Yeah, absolutely.
It is more, you know, so really kind of being kind to themselves too, as a parent. Absolutely. You know, it is already a big thing having one baby. Having multiples is like that's a huge thing, and ask for help too, right?
Yeah, and get as much support as you can, even if it's just, you know, something like paying for a cleaner. Do you know what I mean? It's just that can just take the pressure off having to, you know, having to clean the bathroom. That's always the one that I hate most.
Right, absolutely.
Trying to find time to do that is awful. So
Oh,
you know, just
absolutely.
anything that can help a little bit. You know, if there's friends, families, can someone? There was a lovely family that I supported recently who were very you know, member of a church group, and in the first few weeks after the babies were born, each member of the church dropped a meal off every evening for
Nice.
them on the doorstep, so they didn't have to worry
Oh,
about cooking. They didn't have to,
nice.
and if they didn't eat it, they shoved it in the freezer so that they had it for later on. And you know, so it was just, there's all
Beautiful.
sorts of things that they can
Also,
try and put in place. Do you know what I mean?
perfect.
To help out.
Absolutely. Well, thank you so very much, Kathryn Stagg, for being back here with me again and back at Gold for this fantastic presentation. We're really looking forward to this so much. Thank you for being here with me
Thank you so
today.
much. Thank you.
And now Kathryn's presentation, Strategies for Managing Nighttime Breastfeeding with Multiples, is part of the Breastfeeding Solutions for Preterm and Late Preterm Infants lecture pack. And right now that is the add-on package for our upcoming Gold Lactation online conference of 2025. I would like to encourage all of our viewers to visit goldlactation.com. We have free keynotes presentation included in that lineup of presentations. So I hope you go to the website, check everything out, sign up for the keynotes, and we hope to see everyone at the conference. Thank you everyone for watching. Bye-bye.